Rising throat cancer cases in men linked to oral sex. Recent studies reveal a concerning rise in oropharyngeal cancer cases in Jamaica, particularly among younger men. Dr. Stephen Alexander, Senior Medical Officer at Jamaica's Hope Institute, attribute this spike to the human papillomavirus (HPV), primarily transmitted through oral sex. HPV is increasingly linked to oropharyngeal cancers. No overtaking smoking as the primary cause traditionally showed cancer cases predominantly affected men over 70, largely due to tobacco use. However, with a significant reduction in public smoking, cases now appear more in men aged 30 to 50. HPV-related throat cancers are more aggressive than those caused by smoking, Dr. Alexander explained to the news. This shift is raising alarm within the medical community as HPV-positive cancers pose heightened health risk and often demand intensive treatment. Despite these warnings, changing sexual practices remains a contentious topic. A male who is 36 years old openly admits he won't alter his preferences, comparing the HPV threat to other risks like HIV and STIs. He believes in mutual protection with his partner but remains undeterred by the HPV-related risk of oral sex. Similarly, a 25-year-old female is aware of HPVs linked to cancer but practices safe sex with her husband and has not received the HPV vaccine, feeling secure within her monogamous relationship. In response to the rising threat, Dr. Alexander advocates for the HPV vaccine, especially for young girls ages 9 to 12, as a preventative measure against future HPV-related cancers. Son dead, mother nursing injuries after brazen attack in St. Mary. A St. Mary mother is not only nursing gunshot wounds, but is also mourning the loss of her son after a shooting incident in Anota Bay Friday afternoon. Dead is 23-year-old electrician Marvin Ricky J. Wilson of an Enfield address. Reports are that Wilson and his mother, along with other family members, were on a veranda in Iter Burial Drive River Bridge around 3:40 p.m. when a lone masked gunman entered from the back of the house and opened fire. Wilson ran into the house but was chased by the gunman, who shot him multiple times. The gunman escaped on foot. It was discovered that Wilson's mother was also shot in the left foot, 5 of her toes shot off. She was taken to the Anota Bay Hospital for treatment while Wilson was pronounced dead. The St. Mary Criminal Investigation Bureau is investigating. In the meantime, Acting Superintendent for the parish, Anthony Wallace, told the news that Anota Bay has become a hotspot for crime. The police will maintain a strong presence in the area to reassure the residents of the commitment to maintain peace and security. Another senior manager at the luxury hotel Royalton Negril has been separated from the entity following a protest last month by the workers over their working conditions. The news has confirmed that the senior manager, whose name is being withheld, was sent home on Friday afternoon. He was blamed by the workers for many of the challenges they faced on the job. He joined the general manager, who was suspended in the immediate aftermath of a protest by workers over what they said were the poor treatment of staff by the management, inadequate pay, and being overworked, among other things. The protest impacted the operations of the hotel and reportedly resulted in some guests having to find alternative food. Some guests also came out in support of the workers during the protest, while one guest took to social media to demand a refund of the money she had spent for she expected to be a relaxing vacation in tropical paradise. Following the protest, Daniel Lozano, Senior Vice President of Diamond International Operators of Royalton Negril, rushed to the island for meetings with the management team and some of the workers. Tourism Minister Edmund Bartlett, Senior Advisor Strategist in the Ministry, Delano Sovereign, Executive Director of Tourism Product Development Company Wade Mars, and other tourism officials also rushed to the hotel to settle the dispute. Minister of Labor Social Security Pernell Charles Jr. and his team also visited the hotel for talks. Following the discussions, the workers returned to the job, but they have warned that Normality cannot be guaranteed if the suspended general manager returns to the property, or if there are no improvements in their working conditions. Police Commissioner says no police officer below inspector rank authorized to seize motor vehicles. Effective immediately, the Police High Command has made changes to its motor vehicle seizure policy in light of safety concerns. In the latest force order, published on Thursday, Police Commissioner Dr. Kevin Blake has directed that the officer level for authorizing the seizure of motor vehicles must not be below the rank of inspector. Dr. Blake says the modification is intended to increase accountability, reduce misuse of authority, and ensure that the actions taken are justified and based on careful review of all circumstances. The police commissioner says at present there are many instances in which motor vehicles are seized by the police without due care for the risks to persons and property. Tufton dismisses claims of substandard equipment in the health sector. Health and Wellness Minister Dr. Christopher Tufton has dismissed assertion that the government is purchasing substandard equipment for the use in the island's public healthcare facilities. Tufton's response came after opposition spokespersons on health and wellness Dr. Alfred Dawes made the claim last week at People's National Party (PNP) press conference that some suppliers of hospital equipment have been selling substandard items at exorbitant markups to the health ministry. At a post-cabinet press briefing on Wednesday, Tufton said the focus should shift from blame to addressing the country's lengthy and bureaucratic procurement process. We have a law that prescribes how procurement is done. Now I may have some issues with it, to be totally frank, because I do believe oftentimes it is very lengthy, it's bureaucratic, and we do not achieve the result that we intend to in sufficient time. The minister also acknowledged the challenges within emergency procurement, saying even that sometimes has its own hurdles that have to be crossed. On that score, Tufton highlighted the need for stakeholders to collaborate rather than pointing fingers. So any debate around procurement or using government funds, equipment or buildings or otherwise needs to be taken in the context of that. And I think there is a policy discussion that should be had around that process. But I do leave to suggest that somehow that process is being ignored, and somehow the Ministry of Health is purchasing substandard equipment, Tufton argued. I don't know if the purchasing of substandard equipment, and if it is brought to my attention, I will deal with it. Issues related to the infrastructure of the healthcare system were raised in the public domain days ago after an 11-year-old girl suffering from scoliosis could not have her surgery done at the Bustamante Hospital for Children due to issues with air condition at the hospital's theaters. The University Hospital of the West Indies, UHWI, has since offered to have the surgery done at its facility.